Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
That was Robert F. Kennedy Jr. a year ago. The longtime anti-vaccine activist was sworn in as the nation's health secretary soon after. This was despite concerns that he might undo decades of work around vaccines that helped eradicate diseases like measles and polio in the US. But Kennedy made a series of promises to secure votes for his confirmation. Let's look at what he pledged to senators and where he's fallen short. First, the childhood vaccine schedule.
It confirmed he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes.
That didn't happen. Instead, under Kennedy's instruction, the CDC has drastically overhauled the childhood vaccine schedule. In January, the CDC reversed universal shot recommendations for some diseases, including the flu, RSV, and hepatitis B. Next up, federal funding for vaccines.
If you are confirmed, do you commit that you will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs?
Yes.
And do you commit that you will not impose new grant conditions outside of congressional direction for state, local, or global entities that in any way limits, restricts, or rescinds access to vaccines or vaccine promotion programs?
Yes.
Just a few weeks after Kennedy took charge, $11 billion in COVID-era grants were canceled. Local health departments across the country were using a lot of that money for vaccination programs. A federal judge later blocked this move. Kennedy also canceled $500 million in mRNA vaccine research, and grants for studying vaccine hesitancy were yanked. Then there was the promise he made about the long debunked theory that vaccines cause autism.
CDC will not remove statements on their website pointing out that vaccines do not cause autism.
While the CDC's website does still say that vaccines do not cause autism, it now falsely says on the same webpage that that claim is not backed by evidence, and that studies supporting a link between autism and vaccines have been ignored. That's not exactly true. In fact, a study linking vaccines to autism did get a lot of attention decades ago, but that study was later retracted for being fraudulent, unethical, and inaccurate. Kennedy also promised regular check-ins with Senator Bill Cassidy and the Senate's Health Committee.
Aside from he and I meeting regularly, he will come before the Health Committee on a quarterly basis if requested.
In a statement, HHS spokesperson Andrew Nixon said that Kennedy continues to follow through on his commitments to Chairman Cassidy and engages with him and his staff on a regular and frequent basis. Despite unprecedented changes, though, Kennedy has been called before the Senate's Health Committee just once since being confirmed.